He was saying कि डॉक्टर साहब कितना चलेगा हाँ कि how long it is going to last. So I had a smile was there. So his son was sitting in front of me and his son told that no don't laugh actually हमारे वाले 110 में गए थे. She still have 15 years. Don't worry actually. I say age doesn't matter. Your mental age matters actually. That I really bore to that Mataji, that lady, that she was 96 and she was all ready. So age is not the limit actually.
How do you make them understand about the treatment?
I can complete your job in 2 days, and that's my success story is there. Other guy is going to take 4 to 5 months. You have the option to choose a doctor. If my patients are all happy, everybody will remember me.
Of course.
That's all. Because when the patient comes to you, if I'm going to do any wrong in you, you'll always remember me actually. Okay. But if actually everything goes smooth, maybe after 6 months, 1 year or 2 years, you will forget me who has done the job. So I better want to be forgotten actually. So all the patient will be happy actually. Okay. Always find out or read the innovative ways. In simple terms, always get bored actually. Okay. And find out a new thing. And new thing means that should be beneficial for in your dentistry or in your career.
Welcome to our podcast series where we delve into the minds of groundbreaking innovators who are shaping their respective fields. Today, Dr. Vivek is one of the most successful implant surgeons and has revolutionized the dental implantology in India and abroad. Dr. Gaur's journey began with a passion of merging innovation along with patient care. He embarked on his career with a vision to redefine conventional practices, which led him to one of his latest advancements, which is the corticobasal immediate loading dental implants. These corticobasal immediate loading dental implants have drastically reduced the healing time and the treatment time from months to a mere 48 hours. Dr. Gaur not just treats patients from all over the world, but also trains other implantologists in such immediate loading dental implants. Throughout his illustrious career, Dr. Gaur has not only been a practitioner, but also a prolific speaker and writer. He shares his insights on his field on not just national but also on international levels. In this exclusive podcast, Dr. Vivek Gaur will unveil the secrets behind his groundbreaking technology, providing us with invaluable insights into the future of dental implantology and his remarkable journey in reshaping smiles and lives. Welcome, Dr. Gaur. Doctor, I would like to start with the very basic questions. Please tell us about your social and academic life and how did you enter the field of dentistry? Was it by choice or by accident or did you decide to enter it yourself?
Ma'am, I'm not a new generation actually where now so many options are there for the students actually or for the kids, and they're all driven by the teachers where they're studying like the good colleges are there, IB board colleges are there, and good public schools are there. For me, it was like that. Either you have to become a doctor or an engineer, but I want to become actually. I want to go into the army because I'm a nationalist and I really want to serve in the army. But of course, unfortunately, I had actually some incidents of the polio long back when I was just a kid. So I couldn't able to do. So for me, actually, I was having mathematics and biology both. I am studied from CBSE board, so I have both the options available. So I was writing the entrance examination for the engineering also. I was writing the examination for the medical science also. On NDA, actually, I could able to clear. So that was the whole story was there. So I got clicked in the this thing in medical. I got it in Manipal College, and my rank was not so high. So the option available for dentistry, so I took the dentistry. It's so simple actually.
So this was not by choice.
No, it's like whatever I'm having, it's my choice only. That's all. I look forward only actually.
That's great. Dr. Vivek, I am curious to know when you took up dental implants in 2003.
Yeah, ma'am.
in 2003, this area was in its budding stage, right? Uh, so, what were the challenges that you faced, and was it a difficult decision? And how did you move forward, and what inspired you to specialize in implantology?
This, ma'am, this question has been asked by the others also, and I always say you should get bored in your life actually. So I started the dentistry in 2000. Till 99, I did the internship. I completed my internship, and I was tried for the MDS examination. I am not so intelligent, could able to crack actually the entrance examination. Okay, so okay, and then immediately I started the my dental practice. And my dental practice for 3 years, I was doing the routine dentistry. I was really getting bored. And then it's like a new stream was coming to lasers and the dental implants, a new stream was coming. So I was fortunate enough in 2003, my college, Manipal College, was conducting a very advanced international course in implants. I started the course, and I was the first person in Uttar Pradesh to do the dental implants. And all my colleagues and seniors, they're laughing on me that I'm basically from Eta. It's a very remote town. It's there. Okay. So they were laughing, you are in Eta, and even actually Mumbai people are not so many implant lawyers are there. Hardly the handful of, maybe at that time, maybe 30 or 40 implant lawyers were there all over India. So why come you are so interested? So I simply told me, so I'm getting bored in doing root canal treatment, scaling and all the thing. So I started. And later on, I did the convention implantology from 2003 to 2009. And then again, I get bored of convention implantology. So I started the immediate loading. So you should get bored in your life to move ahead. Okay.
That's a very different take and a very refreshing take, if I might say so.
Okay.
So you started the corticobasal implants in 2009.
I started, see, it is not corticobasal implant. I will tell you. Till 2003, I was doing the 2003 to 2009. I was doing the convention implants. It is called a delayed loading implants. Okay, and delayed loading implant means you have a fixture is there. You have to place in a bone, then it is to heal for 3 to 4 months. Then again 1 month is there to do the prosthesis. Teeth fitting and all the thing. Okay, you have to do. But in 2010 and early 2010 actually, or no, sorry, in late 2009, there was a congress was there, ISOI congress was there in Chandigarh, Mohali, and there I first came to know the immediate functional loading implantology at that time. So then from 2010 onwards, I started. Because you are treating a patient, and then patient is just waiting for 3 to 4 months, and the waiting time was too much. And if you're having a one or two tooth is missing, you can, okay, means the implant is healing and doesn't have problem. My main focus was the patients who doesn't have any teeth, and then actually you are going to wait for 3 to 4 months. So that's why I started the immediate loading. And to start an immediate loading, the right tool was corticobasal implants. So I always say it is not a corticobasal implantology, it is immediate functional loading implantology.
What exactly is immediate functional loading implantology?
Immediate functional loading implantology means there is a certain phases there of the bone to, first of all, the bone means it's like a biological thing. The bone first of all go in a low stage, low mineralized stage or low healthy stage, and then it picks up the health. Okay, it's like in general common term what I'm saying. So when you place an implant, after placing an implant, you're leaving it like that, then it will go in a state of low state, and it's going to take plenty of time to become more active or more stable bone. But there's a rule is there that when you place an implant and start function is given, then the bone picks up very early. So that is the thing is there. If you want, we are doing a immediate functional implantology. So we place an implant, and within 40 to 72 hours, we start functioning the implant. We put the forces on the implant, means we put the teeth and patients start chewing. So that is the concept is there, and this is we are following the orthopedic concept.
Okay.
Means orthopedic concept means, if you know, just everybody knows that when you go for a knee replacement, the orthopedician is not going to place a knee implant and will tell you to just hang around or lie down for 3 to 4 months. Within 2 days, they make you, force you to stand up. So that is the thing is there. Okay. So that's what we are doing in the dental implantology.
So, Dr. Gaur, is there any other difference also between the traditional implants and the immediate loading implants?
if the difference is engagement of the bone, there are two type of bone is there. One bone is there that houses the teeth. The teeth are surrounding one bone. Technical term is salvia bone. And the other thing is there that is having the basic framework of the body, that is called cortical and buttresses. It is the basic framework is there. So in this framework, they are very highly more rigid bone is there, more strength is there. So we place our implants on that bone, and that's how we can do immediate function loading. If you can do with the convention implants also, the immediate function, you have to engage the highly mineralized bone. But the part is that the design of the implant is not practically suitable always to do the immediate function loading. So that is the basic differences there.
Although you've given us an idea about the implants, I still want to ask, how is the process? What is the process of corticobasal immediate loading implants, and how has the process and how have the implants transformed the patient's lives and patient's experiences?
Very general thing. You know about the pyorrhea?
Yes.
Means it's a very common term is the pyorrhea, and in dentistry it is called periodontitis. So it is a pyorrhea what is very common. So you see that in pyorrhea the pus is coming in the mouth and the bleeding is there, teeth are mobile. So you come and almost all the teeth are mobile, and then you come and you are not able to eat. So if you go for a routine dentistry, they will tell you to take out the teeth, have a suitable healing time. Healing time is minimum 6 weeks is there. It's a minimum 6 weeks is there. Then you can go for a denture, removal denture, or with the implants. So they are going to do the convention implants, and then they have to wait for 3 to 4 months, and then you're loading it. Means process will be there. But when actually you come as a pyorrhea patient, means teeth are mobile, we will call you, we will take out your teeth, we will clean up the area. Immediately we are going to place the implant, we will take the impression. By evening, the metal fitting where over the teeth is going to build up, the fitting we are going to check it, and if everything goes well, so within the next day you are going to get the fixed teeth, and you start smiling, actually you start eating. It's going to take time, it's not like that. Means if you do a normal extraction also, normal removal of the tooth, you have to take 5 days antibiotic and analgesic. So it's a normal thing is there. But yes, it's a complete transformation. Within 2 days a patient is coming with all the mobile teeth and then start eating. So that is actually
From months to days.
Yes.
So that's a very, very big difference.
Yes.
Uh, but of course, you mentioned in the beginning also that a lot of people laughed at you, a lot of people, including your colleagues, made fun of you. What were the challenges that you faced in the field, and especially in using this innovative technique?
My basic thing is take the road that is less traveled.
By Robert Frost.
That's all. Means I don't know who has told. Okay, I am not actually good in literature. But thing is, everybody is doing. If I am started the practice, everybody was doing the conventional dentistry, so I have to do something different. So I started the implants.
Okay, so now that you've
Now I'm laughing on them. Actually, nothing is there. I'm not laughing at them because they are my seniors. Their colleagues are there. I'm so happy. Actually, those who are actually against me now, they have made me. They in their panel. Actually, I am like the consultant, and they have made me consultant. Actually, okay. So I'm doing the implants there.
you've come a long way.
Yeah, I'm okay. Yes.
But I do feel that coming such a long way and crossing such boundaries, it is very difficult. You have to have some sort of determination and will, very strong determination.
I love dentistry. I love actually. That is the reason. That's all. I love dentistry. That's all. I don't invest in property. I don't invest in anything. I invest in dentistry. So I love my profession. That's why I'm enjoying. See, actually, I'm really enjoying. And the more complicated case comes, and it's more enjoyable actually. Because the adrenaline is there. The case you are going to complete, you are operating for at least 2 to 3 nights. You won't be able to sleep actually. Okay, and after completing, if the patient smile at you, actually, then you can really have a nice coffee, and you can. So that is the feeling of satisfaction is there.
Talking about such cases, one more question pops up in my mind. Are such immediate loading implants also fit for people of all ages, or are they restricted to people of some ages?
Ma'am, the upper limit is not there, but basically the person has to has overcome the adolescent age. So the minimum age for a female should be 15 to 16, and for a male it's like 16 to 17, and then we should place the implant. That is the minimum age is there. For my, as my personal, I mean, my, if you say I have operated a patient and the lady was, lady is actually, not was, is actually 96-year-old lady was there, and that was before the COVID time, I'm telling you. So now definitely she has crossed 100. And when I after operated, I came to know the age. I was really shocked actually. And the joke part, as she was saying कि डॉक्टर साहब कितना चलेगा, हाँ, कि how long it is going to last. So I had a smile was there. So his son was sitting in front of me, and his son told that no, don't laugh actually, हमारे वालिद 110 में गए थे. If she still have 15 years, don't worry actually. So no, sorry actually, I'm not laughing like that, but of course actually it is always I tell to my patient that the patient comes who are so panicked as theirs. I say age doesn't matter, your mental age matters actually. That if I really bow to that Mataji, my that lady, that she was 96 and she was all ready. So age is not the limit actually, okay, ma'am. But after the age limit is the lower age limit is there definitely for us, okay.
Thank you for sharing such a memorable story.
Yeah.
Are there any other memorable stories or cases that highlight the impact of your work?
Yeah, ma'am. This is I really want to mention when the COVID wave have come actually all over the globally, and then there was a mucormycosis was there, the black fungus. In the black fungus, it was so unfortunate, and the patients were actually so unfortunate that they have taken out with the whole jaw, upper, means you can say about the maxilla. You know, when you drink water or something, if you are going to drink water, it is going to touch your palate. Talu means the palate or the throat, then it's going to go inside. Those were the cases where they didn't have the palate, no throat, direct communication to the throat was there. So they were actually not able to drink water. Please imagine they were not able to drink water, and there was such a risky and such a questionable prognosis was, or success rate was in those cases. So I did my in 2019. I did my first innovative implant. There's an implant is that's called zygoma. Means that there's a bone is that called zygomatic bone. A long implant is there. So I did my implant and engage actually in the just near to the cranium base actually. Okay, it's called glabella, just near to the cranium, near to the brain. Okay, as we say, it's all flapless means actually without giving all the incision, no cut, nothing. I just did it, and I created a tripod. Tripod, your stool is there, na? Three legs will be there, auto tripod, some sort of thing with the zygoma implant. I did it, and then the success I achieved, and now my cases are more than 3 years old is there. So what I want to share is the patient come who is not able to eat, drink, they are not able to speak also, and when I fix that, complete them within 2 days, and I tell them to spit. So when I give the teeth, okay, it's called obturator actually, okay, on the old implants. I give the fixed teeth and I tell them to spit or to rinse. So they are scared to have water in the mouth, and they rinse. Then the glare in their eyes is there, and it has happened 3 or 4 times. In my clinic also I'm sharing, and then the person actually, I told, just call your wife, just call your son. And they called up. So he was speaking after 1.5 or 2 years, and it was such a shocking that the wife started crying, son started crying, and I called up my technician. Please come, because I also want to share the experience of what job you have done. We are making happy a patient actually. So let's see what has happened. So he was shocked actually. What went wrong? I did my best work. Okay. So I don't know. It is the tears of joy is there. So that is the thing is there, but it gives me immense satisfaction.
You must have been over the moon.
Over the moon, I'm there actually when the case has completed 1 year actually. Okay, for me it's like all the complete cases are there. Whatever you do complete cases, you cannot enjoy at that moment. When the case complete minimum 6 months to 1 year in function, then it becomes stable actually.
Doctor, one more question. In the traditional implants, especially when there is bone loss, bone grafting is suggested. What are your views if such bone grafting procedure is also required in the immediate loading dental implants?
See, what is a bone grafting? The bone grafting is when you are have it, the thing goes back to the design of the implant. Now this convention root form implant is there. Their design is like that, they mimic the root of a tooth. So when the root is there, the tooth was there, when the tooth has gone, or maybe because of the pyorrhea or some periodontal disease, it's gone. So there's always a collapse of the bone, resorption of the bone take place. Now you want to see why the collapse have taken place, because it is the inherent property of a bone that the resorption is going to take place, is inevitable. But you just want to place a fixture replicating the root of a tooth, so you do the bone grafting. So there are two aspects are there. Now you do a bone grafting, but it is against the nature. So whatever the bone grafting you are going to do, it has a high chance of failure or resorption will be there. But there's another aspect is there, that when some in cancer patients something, the resection or the extirpation or the jaw has been taken off, full jaw, half jaw taken. So now we do the autogenous grafting. The bone that is taken from your own body, like a fibula is there, like a rib graft is there. Okay, just telling you the example. Okay, so that when we are going to create it, so that is a part of your body, and that vessels also we are going to lag it. So that is always going to stay. Okay, but when, because here the part of the body was lost, that doesn't mean to be lost. So you have created it. Because it was a basic framework of the body was there, but in when you take out the tooth, the part that is not necessary, it will just resolve. So you are unnecessarily creating, actually that part is ready to resolve, it is inevitable that will getting resolved, means lost. Okay, so this grafting and all the thing you are doing only because of the following the design of the implant, that is not so much practical actually for the function. So if you go with the corticobasal implant, that design is like that, they are anchoring only the most vital bone, most predictable bone, the cortical bone. Rest is just a thin shaft is there, polished shaft. So where the bone has lost also, it doesn't matter at all. So for me, the grafting and the immediate functional loading doesn't go side by side at all. Okay.
It's not a problem if the bone is not there.
We have all the cases that bone is not there. That's why we are so convinced the patients are always there for us actually. Mhm.
So with such implants, can they be successfully done in atrophy cases?
Yeah, I discussed about the mucormycosis actually, the black fungus patient.
Yes.
What the worst scenario you can imagine, where you have doesn't have, you have eyes there and there is housing is there, that is the orbital rim is there, that eye is stable, even the lower wall was not there actually. Okay, you have a nose is there, but inside actually nothing was there. Your cheekbones are there, that cause zygoma, cheekbone, sorry, cheekbone, this cheekbone was limited was there, maybe one side was there, one side was not there. That is, I'm talking about the extreme atrophy, extreme bone losses, and that's we have completed. So it's like a commercial is there, but we always joke and say, when others have given up, we start the procedure.
Dr. Gaur, I have heard that dental occlusion plays a very crucial role in the success of an implant procedure. Um, can you please explain what this is to our viewers?
Madam, occlusion means when you are chewing, you are comfortable. If I am going to ask you, just simple question, you will be amazed if I am going to ask, Madam, today you came, from which leg you were using? It's a shocking what I am asking, which leg I am using, which leg, but you are comfortable. But if you have something like you are limping, actually some problem was there, there is a, yes, you notice actually I am taking more of left leg, actually the weight on left leg. So that is actually, if I am going to ask you which side you are eating, you will be confused. So that is called occlusion. When both the side you are eating comfortably, that is called occlusion. And in the implant surgeries, on the normal dentistry, if you are not able to eat both the side comfortable, then everything is going to fail. No? So success lies with occlusion. Hardly 5 to 10% is the surgical work, and 90% is the occlusion and controls and follow-ups. Okay.
Okay. How do you stay updated with the latest advancement and research in implantology, and how do you incorporate them in your practice?
Uh, by means reading the articles, but right now if you talk about the glabella implant, and I one implant I started placing in the base of the cranium, the sphenoid. So you can say I'm going to update others now.
Yes, because of course you train other implantologists.
No, this is this two thing, the glabella and the sphenoid. So glabella is actually, I was the first person to do it actually, okay, in the whole world. Yes, actually, okay. The zygomatic implant placing glabella, I'm the first person to do it, and I reached the mid cranial base also. And so I think I'm updating myself by reading, but I'm going to help others also by my work. Actually, they're going to get updated by me.
So you don't just get updated, you don't just stay updated with the latest advancements, you also are the one who updates.
Yeah, with the technique wise and instruments what is coming, like the latest, the scanners and all the things are there, okay. So whatever I told you, I don't buy property, I invest in dentistry. So in the that piece actually I am purchasing a lot.
Uh, Dr. Gaur, what advice would you give to the inspiring surgeons or the inspiring dentists who wish to specialize in implantology?
I always say, always invest in education. My grandfather, my grandfather is not no more, but he's actually was very good friend, and he always used to tell me, I'm not going to give you blessing that earn money, I'm going to give you blessing that have your name should be there everywhere, okay, become famous. And you become famous only by doing the right thing, honest to the patient. And uh, and if technically if you are honest, actually you will be very successful in all the field. And for the and this all the new dentists and implant lawyers, they are coming, I just tell them there is a learning curve is there, but true to yourself, and don't do the things half-hearted. Whatever technique you are using, read it properly and then start doing it. And always think that you are not operating actually on a non-living, you are operating on a patient. And this patient, if he's happy and after 1 year he's coming, actually he's going to give you such a moral boost. So always be, simple word is be honest, that's all, be honest.
You've already answered my next question, which was what are the qualities that, apart from the technical skills, of course, the qualities that one needs to have for success in this field. But
And always get bored in your life. Yes.
That is one of the qualities.
Yeah, but not, you have to be married always. Actually, it's not like that, okay? You should not be get bored on your married life.
Uh,
Not possible in India, okay?
so coming back to the implants, how do you maintain a balance between the traditional and the innovative implants, and between the traditional and the innovation in your practice?
I told you, by reading and what are the latest machines are coming, okay, I have to go through and I incorporate in my business, in my practice. And the most important thing is the tool I'm having, the corticobasal implant. That is, the tool is there. What is a corticobasal implant? We are talking so much actually and we are not able to explain it. It's a simple polished surface screw is there. And the simplicity is like that. It engages the bone that is the most predictable bone is there. And because of the tool, I was able to do complete such advanced cases. And so when these cases came, so I have the right tools, I was able to complete it. So technically I didn't do anything, I was having the right tool to operate actually, okay. So innovation is coming by the right tool only actually. So I was lucky to get the right tool, the corticobasal implant.
So talking about corticobasal immediate loading implants, one question comes to mind: are there any myths related to such implants?
Yeah, of course. Actually, before the plane, everybody told actually the nobody is going to fly. Okay, okay, so the myths are always there. And when the plane started flying, they say, "Come on, we are just watching. You will fall down. Don't worry." Actually, okay. So that goes with the implants only. But the myths are that this is immediate loading. They can fail, but no. But people doesn't understand. Actually, the implantology started as a immediate loading only, and it started from 1953-54 from Professor Linkov onwards. So the real struggle Professor Linkov has faced by just doing he just become a dentist, and within 4 months after becoming a dentist, he operated his first implant. That was the first implant in a human mankind actually, okay, in a modern scenario, modern era. Professor Linkov from New York, okay, from USA. So these immediate implants is not a new thing. It all implantology started from there only. So if the people are raising question or myths are there, it is just they have to read it. That's all actually. They have to learn.
Yes, I'm sure almost all your patients raise such raise such questions. So, doctor, how do you educate them, and how do you make them understand about the treatment?
Simple. I can complete your job in 2 days, and that's my success story is there. Other guy is going to take 4 to 5 months. You have the option to choose a doctor. That's a simple thing actually. No need to tell. Means there the literatures are there, Google is there, everything is there. But ultimately, we are so lucky in India. I always say actually we are so lucky to be practiced in India. India is still actually the patient believe in doctors actually. Okay, huh? So ultimately, after reading everything, they go actually with the nature and the honesty of the doctor, and they trust you. And then our job is there that we have to make the work perfect.
Yes, and that is why you have such success stories, and people, they are just.
I had failures also, but I corrected everything my failure. That's all actually. Okay, not 100% success can be guaranteed by God only, not by not anyone.
Guaranteed by anybody in the earth.
Yes.
Dr. Gaur, what role do you see technology playing in dentistry, particularly in the field of the treatment outcomes and the patient care?
Very good. Just now I'm coming actually. Like the afternoon session is there. Morning I was operating. After operating, there's a latest scanner is there. I'm using. I'm not going to use the brand name. Okay, huh? But latest scanner, the world's latest scanner is there. So I placed my implant, and I developed actually a digital protocol in India for the single piece implant, for cortico-based implant. I scanned it and I sent it to the remote lab to the Mumbai. Okay, and they started operating with the latest gadgetries and high quality materials. And by tomorrow they are going to send me the file. I'm going to print it out and I'm going to try it on the patient mouth. And so actually you can see I'm operating in Delhi. My lab is in Mumbai, and I'm completing in 2 days. So that is called investment in technology and taking the advantage of technology. And we are fooling the best one. We are completing the best one for our patient.
So I think this is one of the projects that is going on, or are there any other research or projects that you are actively working on at the moment?
Project, there's two sort of project is there. One is we are starting a brand clinics actually, that's called Simpladent clinics. Okay, huh? Where the all the quality work should be given. Okay, and the highly trained dentist should be there, highly trained implantologist will be there. And the other part is, of course, whatever we are doing daily operating, the success story is there. We have to do the control follow-ups, and we have to write the articles, we have to publish it, and that's how we are training others. So these are the two sort of projects are there, okay, for us.
Sir, you are one of the leaders in your field.
I'm following my
Without
mentor,
doubt.
Professor Stephen Day. I'm not a leader actually.
One of them,
Yeah, yes, ma'am.
you are being too humble.
Yes. No, it's okay. Yes.
You are just being humble. So, according to you, how do you see the dentistry evolving in the next decade?
Yeah, I'm more specific on the implants. I'm saying you, and I'm really convinced now that delayed loading and immediate loading, the question is just getting fading away. The past was the immediate loading. Present is still for me the immediate loading, and the future will be the immediate function loading implantology.
And how is the Simpladent Group uh, moving forward? Are they opening any more centers? Because we've heard that's the news.
Yeah, Simpladent clinics actually. Because Simpladent clinic is we are training our colleagues, and those colleagues who are doing really good work. So we are offering them the Simpladent clinic. So and with the best equipment they should be having, best training they should be having. Every continuously after 6 months to 1 year, we are updating them. I'm also updating myself. It's not like that I'm not updating myself. So we are all colleagues are there. So we are opening a Simpladent clinic so we can give the best work to our patients. Okay, huh?
As I talked about it earlier, you are not just limited to India, be it Delhi or Mumbai.
Yeah.
You are uh, a pioneer in this field, and you have patients from all over the world.
Yes.
So, for our audience, I'm sure they must want to know how can a person from outside of India, belonging from a foreign country, how can they plan a trip and get implants by you?
Ma'am, dental tourism, this all the things started. Health tourism is there, okay. And the other guys have started means they have started spoiling the name of India, okay. They were like that. The patients are coming, they do anything, and then tell the patient, and patient are leaving. Actually, now there is no follow-ups. Follow-up means no checkups, nothing is there. So if any foreign patient is coming to me, I just keep it a minimum of 3 weeks. He has to stay in India. I will be completing the job in 2 or 3 days. Then at least 3 or 4 controls or checkup will be there. Then he can go back, and then actually within 4 to 6 months again he has to come down to have a checkup. Then an annually he can come down for a checkup, and he can just like incredible India is there. He can just tour India all over, and then he can just have a checkup. And if the patient say, "Doc, I cannot come," so I just refuse to take that patient.
Dr. Gaur, this is also one of the reasons I said earlier, I told you earlier that you are being too humble and you are definitely, genuinely one of the leaders in your field.
Okay, thank you, man. Thanks for appreciation.
And being such a larger than life personality, and you've done so much for the field, and you are leaving behind such a huge legacy. So what legacy do you hope to leave behind so that people remember you, because you've done a lot of contributions in the field of dentistry? So
Means if my patients are happy, everybody will remember me.
of course,
That's all. Because when the patient comes to you, uh, and it's like that, I tell them actually, if I'm going to do any wrong in you, you'll always remember me actually. Okay. But if actually everything goes smooth, maybe after 6 months, 1 year or 2 years, you will forget me who has done the job. So I better want to be forgotten actually. So my all the patient will be happy actually. Okay. Because
that's a very different take.
yes, of course actually, if something goes wrong, you'll always remember, hey, this was the guy was there. I'm struggling. And yes, there was one person was there. I will have to first find out the prescription paper. It was done 10 years back actually. Some clinic was there. Okay.
That's a very, very different and refreshing take. And it's so great that you're fine with it.
Yeah.
Because you are so confident in your practice that you know that patients will come.
Yeah, if you have done the good job, patient will come. That's simple.
Will come.
Yes, sir.
So now that we have come to the conclusion of our
Yes, ma'am.
podcast, are there any last words you would like to tell our audience?
It is just like that. Uh, be thorough in your knowledge, cultivate your skills, be honest, and means in your field actually don't stick up actually. You don't stay what you're doing. Always find out or read the innovative waves. In simple terms, always get bored actually. Okay, and find out a new thing. And new thing means that should be beneficial for your uh, in your dentistry or in your career. Okay, that is the thing is there. Nothing more than that I can say, because I'm a dentist. I love dentistry. Nothing else. Yes.
Dr. Vivek, we would now like to conclude our podcast.
Thank you.
And our heartfelt thanks to you.
Thank you, ma'am.
Thank you, viewers. In case you have any queries, please write them in the comment box, or you can also WhatsApp us or call on +91 844 844 7763. For more details, you can also visit the website of Simpladent Clinics, www.simpladentclinics.com. Dr. Gaur has also launched his own website, www.drvivekgaur.com. We now conclude this session, and we will be back soon with more sessions on dental health education. Goodbye.